Welcome to another chapter of sleep medicine and physical therapy. Today we're going to cover the topic of exercise and sleep in part 5, physiotherapeutic resources to improve sleep. I'm Chris, physiotherapy student. Although the underlying mechanisms of how it improves sleep is not understood, exercise training is still widely recommended as a strategy and alternative to traditional forms of treatment for the management of sleep-related problems due to its low cost and easy access. Research conducted in the area of exercise and sleep attribute its positive effects to a variety of mechanisms such as thermoregulatory function, repair and restoration theories, and anxiolytic antidepressant effects. However, these mechanisms are largely speculative as few of them have been rigorously evaluated. Thermoregulatory. The thermoregulatory theory suggests that exercise-induced increase in body temperature is responsible for improving sleep, as during the 24-hour period, changes in body temperature due to exercise are associated with greater probability of staying awake or sleep. Body temperature tends to decrease near sleep onset, requiring vasodilation of the distal extremities and increasing peripheral blood flow. Thus, an exercise-induced increase in body temperature could promote sleep onset through the heat dissipation mechanism. Research on the effect of aerobic exercise on body temperature has shown divergent results, such as positive changes in slow-wave sleep or lack of changes, highlighting the time of day and the intensity of aerobic exercise as important factors that may lead to different effects on body temperature and consequently on sleep. Repair and restoration. Two theories regarding the purpose of sleep, the energy conservation and repair and restorative theories postulate that sleep is a way to conserve or restore the metabolically active tissues that are impacted by exercise. Both of these theories assume that increases in the energy expenditure will be related to increases in the duration of sleep and slow wave sleep. Therefore, the exercise would represent a stimulus for the depletion of energy reserves, playing a significant role in sleep. These theories are based on homeostatic mechanisms of sleep regulation, with adenosine being strongly related to sleep drives. Studies with protocols of moderate to high-intensity aerobic exercise have observed increases of 2.9% in slow wave sleep duration in humans after high-intensity exercises, and in adenosine concentrations measured after high-intensity exercise in animal models. Anxiolytic and antidepressant role of exercise. Sleep disorders are closely associated with mental health conditions. Anxiety and depression are commonly observed in patients with sleep problems and are risk factors for the development of insomnia. Relatedly, insomnia is a risk factor for the development of anxiety and depression, highlighting the bidirectionality of insomnia and anxiety and depression. Thus, considering the beneficial effect of exercise on anxiety and depression, the antidepressant and anxiolytic role of exercise may serve as a potential mechanism to reduce sleep disorder severity and to improve sleep quality. Changes in the circadian system. Exercise performed at different times of the day may influence the timing of the circadian system, advancing or delaying the sleep-wake cycle. Considering that several sleep disorders are related to circadian function, in this hypothesis, exercise could modulate the timing of the circadian rhythm, advancing when performed during the day or delaying when performing in the night. Thus, exercise could be an external facilitator of circadian adaptation in people who need to alter the timing of the sleep-wake cycle, such as travelers and night workers. Impact of exercise on sleep quality. Although sleep quality is an indicator widely used by the general population to assess sleep in clinical practice and in laboratory settings, its concept is quite broad and involves several parameters. There is still no consensus on what constitutes a good sleep quality, with its assessments generally occurring in a self-reported manner. Some variables, for example latency, number of arousals after sleep onset, efficiency, can be considered indicators of sleep quality. Although research reports that exercise improves sleep quality, there is a paucity of studies evaluating the isolated effect of interventions, with sleep quality often being assessed in conjunction with other sleep parameters in a variety of populations and conditions. For example, a meta-analysis of 6 studies and 305 adults examined the effect of interventions between 10 to 16 weeks of moderate intensity aerobic exercise and strength training on sleep quality assessed with the Pittsburgh Sleep Quality Index. In addition to an improvement in overall sleep quality, they observed decreases in sleep latency and sleeping pill usage. Another systematic review evaluated the acute and chronic effects of strength training alone and combined with aerobic training on the sleep quality of adults. The authors observed that combined training, aerobic training plus strength training, promoted better results in the subjective parameters of sleep quality, primarily assessed using the Pittsburgh Sleep Quality Index. Despite these interesting results, the methodological differences between studies included in this review do not allow us to indicate how combined training was superior in improving sleep quality when compared to aerobic or strength training performed alone. The results of clinical trials similarly have demonstrated heterogeneity in findings according to the population studied. For example, in the sample of adolescents, 12 weeks of moderate intensity aerobic strength training improved sleep quality by 67%, sleep efficiency by 7.6%, and sleep duration by 64 minutes. The sample of inactive older adults, the effect of 12 weeks of exercise training was assessed using the PSQI sleep quality scale. They observed sleep quality improvements in the group that practiced physical activity according to the recommendations of the WHO, and there's a 34% reduction in PSQI score. In the group that performed high-intensity interval training, there's a 34% reduction, and in the group that performed high-intensity interval training plus whole-body electrical stimulation, there's a 40% reduction. In another study, strength training performed for 12 weeks significantly improved the sleep quality of patients with breast cancer. On the other hand, in a sample of middle-aged women, the improvements in PSQI after 4 months of practicing yoga and walking exercise were not observed. Finally, in a robust review recently published, it was observed that longer bouts of exercise training resulted in better sleep quality outcomes. Thus, considering the findings represented, exercise training can be recommended as a tool for improving sleep quality. Despite this recommendation, due to its methodological limitations, it remains challenging to establish which type of exercise, intensity, and duration would promote better responses in the sleep quality in various populations. Exercise timing. Although exercise performed in the evening is sometimes discouraged due to concerns that it may disrupt sleep, little evidence corroborates this assumption, and experimental studies have not found negative effects of exercising in the evening. Based on data from the National Sleep Foundation Sleep in America poll, it's evaluated that respondents sleep according to the time of day of exercise. They found that most participants believed that their sleep was of equal or better quality, with 97%, and longer duration in 98% of the participants on the days they exercised in the evening. That is, less than 4 hours before bedtime compared to the days they did not exercise. The paucity of negative effects of evening exercise on sleep was also evidenced in a recent meta-analysis of 23 studies that exercise in the evening, 4 hours before bedtime, or less than that, promoted an increase in 7.7 minutes in rapid eye movement latency, an increase in 1.3% in slow wave sleep, and a decrease in 1.0% in stage 1 sleep. The effect of exercise training on insomnia. Insomnia leads to both health and quality of life problems. Although the hypnotic medication is the main treatment for insomnia, the most recent literature has pointed out that exercise training is a relevant adjuvant or alternative treatment. In a sample of adults with insomnia, it's compared that the effect of 3 different types of acute exercise bouts, moderate intensity aerobic, high intensity aerobic, and moderate intensity strength training. And it is identified that there's a 55% decrease in sleep onset latency, an 18% increase in total sleep time, and a 13% increase in sleep efficiency, in addition to a 15% reduction in anxiety before sleeping in adults that performed a bout of moderate intensity aerobic exercise. Clinical data of aerobic exercise training in samples of adults with insomnia seem to point in a direction similar to the results from studies that examined the impact of a single exercise session. In inactive adults with insomnia, improvements in overall sleep quality, as assessed by PSQI, sleep latency, sleep duration, sleep efficiency, and depressive symptoms, in addition to significant reductions in insomnia severity, occurred after 16 and 24 weeks of exercise training, respectively. Despite the aforementioned beneficial effects, the studies mentioned have small sample sizes and different measures of sleep quality and insomnia, preventing broad conclusions about these findings. Moreover, the impact of exercise-related factors such as type, duration, and intensity remains unknown. In a longitudinal study of more than 1,000 older adults, lower levels of physical activity, as well as presenting some degree of depression, were directly associated with increased incidence of insomnia, with low levels of physical activity corresponding to 5.2 times greater odds of developing insomnia. This scenario was also observed in another investigation involving more than 3,000 adults, where the lack of habitual exercise was associated with 30% greater odds of having insomnia. Final words. Exercise training impacts sleep in those with and without sleep problems. Multiple forms of exercise, that is aerobic, strength, and combined, improve several sleep parameters, including dimensions such as quality, daytime sleepiness, and insomnia. However, due to the methods used in various studies, it is not possible to establish how different variables of an exercise program, such as intensity, duration, type, and number of exercises, can impact sleep and its associated disorders. There are probable mechanisms that seek to explain how exercise improves sleep parameters. However, there is no predominant one, and the available probable mechanisms remain largely speculative. Finally, we can state that exercise training is a promising tool for the management of sleep and its disorders, promoting well-being and impacting factors that go beyond those that are objectively assessed, including aspects of daily functions such as sleepiness, sleep quality, and daily quality of life. This is Chris on the topic of exercise and sleep. Hope you've enjoyed the video. Thank you, and signing out.